Hi there, my name is Navida Dolopo. I'm a licensed acupuncturist and I practice in beautiful Laguna Hills in Orange County in Southern California. I've been in practice since 1999. This is my 21st year in practice, and the name of my practice is Elements in Harmony, Acupuncture, and Chinese Herbs. You can find me online at elementsinharmony.net. My office number is 949-305-1703. So I'm going to present today my 87th YouTube video, and this is regarding a herniated disc of a woman who was 61 years old when she started to see me. Her first treatment was on November 30, 2018, and her 43rd treatment was May 13, 2019. That was a Monday. That following Sunday, she was moving back to Australia. She is originally from Cambodia, but she'd been living in Australia since she was in her 20s, so she's Australian. Before I go through the case, I just want to tell you what the results were. When she came in, first of all, she could barely walk in. And when she left, she was at 80% improvement when she wakes up, 95% improvement throughout the day, and 100% improvement at night. So when she first came in to see me, she could barely walk, which is, consistent with what the doctors were recommending, that she should have surgery. She and her husband were adamant that she did not want to have surgery, and I was concerned because this is obviously a structural issue, and she had seen an acupuncturist right before she came in to Orange County. They were here from November until mid-May, and I was concerned because she saw another acupuncturist who does the traditional acupuncture. You put the needles where the pain is, and I believe it's L4, L5, S1 where the herniated discs are. And she had done 5 treatments in a row, every day, back to back, with very minimal results. And when she came in to see me on November 30, I was hopeful, but at the same time I was very, very realistic. And I told her that this would take a while. I mean, this wasn't a woman who happened to have a herniated disc and she was relatively pain-free, but it would just act up. This was a constant type pain. And so let me tell you what the treatment dates were, and roughly how much she spent, in case you're interested. For those of you who might be dealing with some back pain, especially if you have a herniated disc or something of that nature, bulging disc, or issues with the spine regarding the disc. So November 30, then she came in December 3, 4, 6, 7, 8, 10, 11, 13, 14, 16, December 14, 17, 18. Then it was the holidays, and she took holiday back to Europe to visit her. She has sons there. So let's see how many she did just in December. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. And you can see that they were almost back to back in December. She was very aggressive because she knew that she wouldn't come back until mid-January, which she did. And so she saw me January 15, 17, 22, 25, 29. So in January, when she came in to see me, and then January 31. So when she came in to see me in January, she came in 1, 2, 3, 4, 5 treatments in January. And then when she came in to see me, let's see, in February, it was February 5, 7, 11, 12, 14, 19, 21, and 26. So she saw me in February 1, 2, 3, 4, 5, 6, 7, 8 times in February. And then she saw me in March 4, 8, 11, 15, 19, 21, 25. So that's 1, 2, 3, 4, 5, 6, 7, 8 times in March. And then April 1, she saw me, April 1, 9, 12, 15, 19, 22, 29. So in April, she saw me 1, 2, 3, 4, 5, 6, 7. And then in May, she saw me 2 times, May 6 and then May 13. So you can see how aggressive she was. I wanted to present those dates to you because it's not that she did 43 treatments in 43 months or half that time in 20 months. She saw me 43 times from November 30. So pretty much, let's say December. So it's so close to the end of the month. So December, she saw me December, January, February, March, April. 5.5 months, she committed to 43 treatments. So again, let's review this, because this is a presentation that I'm giving to potential patients who might be suffering from severe back pain and going down the leg, including numbness and severe discomfort and spasms, not feeling comfortable at all, unable to sleep well, unable to walk well, unable to stand, doing dishes, standing in one position for a while, unable to do regular, housework. There were times when she had to be driven here by her husband. After about, I want to say about 10 or so treatments, I did put her on a formula by Evergreen Herbs called Back Support HD for herniated disc, and she also took As Needed Herbal ANG, one of Evergreen's fantastic formulas. So, there were times in this case where she came in, from the get-go, she was unable to walk. And then we saw her move progressively. And it did get worse before it got better. And what I tell patients is, in those first 5 to 10 treatments, if you get better, I'm obviously very happy. If you get worse, actually, in those first, especially 3 to 5 treatments, if not 5 to 10 treatments, I'm okay with that. I'm kind of happy because things are changing. And then, it's when nothing happens, those first 5 to 10 treatments, that I get very concerned. So it wasn't that there was nothing going on. There were times where it started to get better, but then it got worse, and she just stuck with it. She did send me a text in the beginning saying, Anna, I think the needles definitely help the pain going down quicker than just lying down alone. After resting with needles, the pain is getting better. This is at the beginning of our practice together. However, it creeps back on after a while. The pain in the afternoon is less than in the morning. This was a text sent to me within the first 10 treatments. Waking up in the morning is a bit tough. The pain is throbbing. I have to stretch, apply a heat pack, and ride an exercise bike to ease the pain. This was every morning she had to do that. Towards the end, towards mid-April to May, she didn't have to do so much movement in the morning just to feel okay. Excuse me. My back pain is not the problem, only now and then, but the left buttock and calf pain are fluctuating, especially the buttock. We read, so she said she had read the herbal information, and they were thinking about they should try it. It sounds good as a pain relief. Thank you so much for your work. So we'll call this woman Kay. So again, I want to reiterate what we accomplished with this particular woman. She had a pretty intense herniated disc issue in which her doctors, her pain management, I'm looking at her MRI right now, her doctors, orthopedic, were recommending, having to do surgery. And they were pretty adamant that, the surgery would help her. She and her husband were, quite serious about not having to do the surgery. And I have this accountability sheet, and I did my accountability part 4 video that I shared with her what to expect. And if by the 10th treatment, if we're not at least 20 to 30% improved, I'm usually, not that I'm not willing to continue with the case, but I want to give realistic expectations. So again, after 43 treatments from November 30, 2018 until May 13, she went, her improvement was 80% in the morning, not having to do all this vigorous exercise just to feel better. And then she was 95% better during the day and 100% better at night. She's able to sleep. That's very significant, especially for myself as a practitioner, because my immediate goal, my goal with this patient was for her to be able to get to 90-95% improvement minimum, because I have an amazing friend who's an acupuncturist in Perth, Australia, whose name is Rodney Capriotti, and I'm sure I'm pronouncing your name incorrectly. I believe it might be Rodney Capriotti. And you can find him on Facebook, you can find him online. He's an amazing acupuncturist. He studied with Dr. Tan and among many other acupuncture masters, and he's extremely competent. So I really wanted to, my goal was to send her back to Perth, and he's like 10 minutes away from her, so it couldn't have been more perfect. And I already contacted him about her, but my goal was to send her back with at least 90-95% improvement, so he wouldn't have to do as much. And I really, pushed myself with this practice, with this particular patient. Just to give you a rough estimate, what she paid for, she did 42 follow-up visits, and let's say, because she came so frequently, my follow-up case is $65, but my follow-up rate is $65, but if you come back within 3 days, it's $60. So you can see how often she was coming. So let's say 42 times 60, it was $2,520 plus my initial rate, which is now $100. And so she probably paid around $2,620. The exact numbers are in my book. I'm just giving you a rough estimate, but that's, give or take a few, and probably off maybe $10 or $20, but that's probably what exactly she spent. Plus she bought the herbs. So under $3,000, she got 95% improvement during the day, 100% at night, and 80% in the morning. This is a great case, I think, for a person with severe herniated disc. She came in with her MRI. She came in, she was very clear with what the results were from seeing the doctor and what they recommended. The diagnosis actually was spondylolisthesis and herniated disc. I'm sure I am not pronouncing that completely. And she had this for about a year, and she was talking about the way she explained it in her paperwork is that she had severe pain in the left buttock, pain behind the left knee, going down the leg. And there are many people who come in with that kind of pain, with that kind of suffering, with the inability to do basic things like walking, the inability to drive. And so when I saw that she was able to come here so frequently, driving herself, that's huge stuff, huge stuff. So I'm really, really happy with this case. So if you know of anyone who's suffering from a herniated disc, back pain, from whatever chronic pain, just let them know that acupuncture is a viable, something to use. I do balance method acupuncture. None of the needles went to the lower back. None of the needles went to the lower back. None of the needles went to her specific, like her buttock area. She kept her clothes on. They went either in the arms, in the hands, in her feet, in her calves, but none of the needles went to the direct area of pain. So that's probably something I should have explained in the beginning, but I advertise that so much that my patients know if you've got coccyx, tailbone pain, none of the needles are going to go around your back at all. If you have neck pain, if you see any of my other videos where I graduated people or significantly improved them from neck pain, none of the needles went to the neck. My definition of significant improvement is 80 to 99% improvement. I can tell you that this woman is very, very happy. I really hope that the trip to Australia, that long flight from Southern California, was a good one, and I'll be following up with her in about a couple of weeks to a month just to see how she's doing, but I'm certain that she's in great hands with Dr. Rodney Capriotti. And if you're in Southern California, and especially if you're in Orange County, if you'd like to see me and you have lower back or any kind of pain, if you can point to it, I can treat it. You can please go to my website at elementsinharmony.net. You can schedule right there. You can call me at 949-305-1703, or you can text me on my cell phone. My landline always goes to my cell phone. You can text me at 619-341-4341, and I look forward to hearing from you. Have a great day and have a wonderful, wonderful Memorial Day. Take care.